Today we're going to talk about the 3 key exercises that every pregnant woman needs to be utilizing throughout their entire pregnancy. I'm Dr. Rodney White with Sapi Chiropractic, and thanks for joining us. The 2 reasons that we need to do these exercises is, number 1, we need to keep that pelvic floor muscle functioning exactly how it needs to be able to go strong when it needs to, so that there's no urinary incontinence, and it needs to be able to relax when needed to aid during the childbirth delivery process. The other thing we have to make sure when it gets time for delivery is hips and pelvis have to be functioning at their absolute best, and they can't be tight or restricted in any way, because again, this can cause interruptions to baby's passage on the way out into the world. So let's talk about these 3 exercises. Number 1 is the Kegel exercises, and I'm sure a lot of people have heard of this, but let's make it really simple for you. So this involves tightening the muscles that can actually stop you when you're halfway through peeing. So you don't have to only do it at that time, but this might be the first time that you try it. And so maybe when you're going to the restroom, try and stop the flow of the urine and see if you can do that. If you can, great, you've just found your pelvic floor muscles. Now throughout the day, in a perfect world, you want to hold that, so tighten it, hold for 10 seconds, breathe normally throughout the process, slowly release, and do that a rep of 20 times. And then you could do that 5 times a day. It doesn't have to be when you're actually going to the toilet. That's just a good way to learn how to use those muscles. That will help your brain get really good control over that pelvic floor. The second thing we need to do is keeping the hips and pelvis nice and open and loose as figure 8. So this is especially important if you're still working throughout pregnancy and you're sitting a lot throughout the day. Multiple times a day, at least once an hour, you want to get up, grab the back of your chair. We'll pretend this is the chair, so this is a little bit too low for me, but that's okay. And you just want to do figure 8. So literally what you're doing is pushing your hips as far as you can in every direction and getting that maximum movement out of it, and reasonably slow, because you want to get that full stretch and really exaggerate it, almost like you're trying to push your hips as far as you can. That's going to help a lot. Then the third thing we need to do is our pelvic tilts. This will help both the mobility of the pelvis and the hips, and it will help activate that pelvic floor. The best way to do these is either on the ground as a hip bridge or sitting on something like an exercise ball. The reason I want to show you here is because we'll give you an extra bonus tip if you are sitting at work all day while pregnant. So with a pelvic tilt, you're just simply rolling your pelvis back and forward, and an exercise ball really helps. Now you don't want just the ball to be moving you, you've got to actually tilt your pelvis like that. Now the reason that I use this, if you are sitting, a lot of women are told to sit back in their chair and let their body go like this. There's a reason that our body does a natural curve like this when we have a belly. That can be a pregnant lady, it can be any male or female who's got what's known as a beer belly or any kind of protrusion in the front. We're going to go into this shape. It's because it's natural. Our brain's trying to get our weight bearing centered better. So if you are sitting, you want to make sure your hips are above your knees, sit on the edge of your chair or exercise ball, and let that natural curve kick in. Not only will that ease a lot of the pressure on your back, but it's going to help keep the pelvis tilted in the right direction, and it's going to keep everything functioning properly. So hopefully those 3 exercises will be of value for you. If you have any questions, please reach out to us. If you've got any back pain or pelvic pain or any kind of issue like that during pregnancy, then chiropractic may very well be able to help. So if you're in the Omaha area, you can go to sapichiro.com, click on the big yellow button there, and someone from our team will reach out to you and see if there's anything we can do to help. Thanks for watching. We'll see you next time.